Hello everyone, Dr. Mosen here. In the previous episode, we discussed different effects of THC versus CBD on anxiety. Today, I want to address a practical yet complex question. Should we use CBD dominant cannabis or over-the-counter CBD products for anxiety? To tackle this question, I synthesized evidence from various sources, including an insightful official report on CBD by the Substance Abuse and Mental Health Services Administration, 2 comprehensive systematic reviews meta-analysis, and an expert review on the adverse effects of cannabis. You can find all these sources in the captions. As usual, I'll begin with a more detailed discussion, and towards the end, I'll provide a summary. It's no secret that CBD has received immense attention in both the medical research community and the self-care market over the past decade, attracting investments from various pharmaceutical companies into CBD-related products. However, it seems that this heightened interest is more rooted in market-driven hype surrounding CBD and cannabis-related products rather than reliable scientific evidence. Despite anxiety disorders being a prominent focus in CBD research, the first ever phase 3 CBD clinical trials aimed at FDA approval for anxiety-related indications are still underway, awaiting outcomes. It's worth noting that to date, the only FDA-approved CBD product is Epidiolex, which is specifically approved for 2 rare forms of childhood epilepsy or seizures. Epidiolex is solely accessible by prescription from a licensed physician and stands as a relatively expensive medication due to several reasons. Firstly, the extraction and purification of CBD are intricate processes necessitating pharmaceutical-grade equipment and rigorous quality checks. In fact, the majority of the over-the-counter CBD products in the market contain varying levels of THC and other cannabinoids, with many failing to disclose this information, posing a significant concern. Secondly, CBD is a highly lipophilic compound, leading to a low-efficiency absorption process that varies significantly from product to product and person to person. Some pharmaceutical companies have invested specifically in enhancing CBD absorption by introducing novel formulations called self-emulsifying nanodomains. Although Epidiolex is not a nanodomain product, it remains among the few pharmaceutical-grade CBD products with a relatively predictable absorption profile. On the contrary, most over-the-counter CBD products exhibit either low or unpredictable absorption rates. Last but not least, pharmaceutical-grade formulations like Epidiolex enable the administration of CBD at clinical doses, typically exceeding 200 milligrams. In contrast, the concentrations of CBD in most over-the-counter products are much lower. Therefore, to reach clinical doses with these products, one would need to consume much larger quantities, increasing the likelihood of adverse effects. Additionally, similar to any other medication, even pure forms of CBD like Epidiolex are associated with adverse effects, most commonly nausea, headache, fatigue, drowsiness, and some other less frequent adverse effects. Setting aside the discussion about CBD products, it's crucial to emphasize that CBD-dominant cannabis strains are subject to numerous serious short-term and long-term adverse effects due to the presence of hundreds of other constituents in the cannabis plant, many of which have not been thoroughly studied yet. Some of the most common significant long-term adverse effects of CBD-dominant cannabis can include cognitive and memory impairment, psychosis, malfunction of anxiety-related brain circuits due to THC contamination, which can lead to increased anxiety with long-term use, and so on. In summary, pharmaceutical-grade CBD is not yet FDA approved for any anxiety-related indications, and non-pharmaceutical over-the-counter CBD products are even less reliable due to potential contamination with THC and other cannabinoids, as well as highly variable and insufficient absorption. Moreover, any CBD product, whether pharmaceutical or over-the-counter, is associated with the possibility of adverse effects, with over-the-counter ones presenting additional risks. On the other hand, even with future FDA approval, there is a need for further studies to determine if CBD is as effective as the currently available medications for anxiety. Notably, when it comes to anxiety, there are several FDA-approved medications with well-documented effectiveness and tolerable adverse effects. These medications can be prescribed by your primary care provider at low or no cost. In addition to medications, various evidence-based psychotherapy techniques for different types of anxiety are available, best learned through therapy sessions with a mental health provider. Some of these techniques can also be self-learned and are freely accessible to the public through YouTube videos, apps, and books. I hope you found this episode informative. Stay safe and stay tuned for another episode of Psych Minutes.